introduction. Good morning, everyone. I'm Hyun Yoo from Seoul National University Hospital. It's a great honor to present my lecture here. I'm currently specializing in liver transplantation anesthesia, so I'm not an engineer, but an anesthesiologist who takes care of surgical patients in the operating room. So today's talk will not focus on the technical details of AI, but instead, together with some studies I've involved in, I'd like to introduce some examples of AI-based surgical risk prediction models. This lecture has three learning objectives. First, to learn how the anesthesiologist's role is evolving in the perioperative medicine and why surgical risk prediction matters. Second, review some representative examples of AI-based surgical risk prediction models. And finally, recognize the key challenges and requirements for successful clinical implementation of AI in anesthesia practice. Here's a brief overview of my presentation. Yes, so what's the role of anesthesiologist in the operating room? While a patient is under anesthesia, we continuously monitor various parameters to maintain hemodynamic instability. But when sudden hemodynamic collapse happens, just like you've seen here, we must stay calm and think fast and perform immediate resuscitation to bring back to patient safety. In the past, anesthesiologists mainly work only inside the operating room, but today our role has been expanding across the entire perioperative care. At the center of this transformation are data-driven approaches and artificial intelligence. Let's begin with why surgical risk prediction matters. There are many reasons for this. Above all, early identification of high-risk patients allows clinicians to do better resource allocation and timely intervention. In recent years, use of AI in the medicine has expanded dramatically. As shown in this figure, the AI application already spanned the entire patient journey from embryo selection and ECG interpretation, and even in hospital mortality prediction. So there are numerous AI prediction models. So among them, I'll introduce some examples from including my own work and other teams' efforts from simple machine learning model and multimodal deep learning model. And I also briefly touch on emerging approaches using large language models. When I first started exploring AI research topic, there are so many complications after surgery. However, postoperative pulmonary complications stood out for an anesthesiologist because of their direct relevance to perioperative respiratory care. So we focused on predicting postoperative pulmonary complication and compared its performance with traditional statistical tools. So the reference model we use for comparison is the RSQ risk score. As you know well, the RSQ risk score was developed in large prospective multi-center cohort in Spain. It uses 7 clinical variables with the logistic regression and demonstrating excellent discriminant performance. After the first publication, this model was externally validated in multinational cohort across 21 European countries, again showing the good overall discrimination. So initially we aimed to